Good evening and welcome. My name is Aidan Hamza and I'm the policy lead at the Canadian Nurses Association. I would like to begin by acknowledging that this online meeting place reaches across Turtle Island, the sacred land which for thousands of years has been and continues to be home to many Indigenous peoples, with whom we are honored to be in relationship with. We're incredibly excited to be hosting this virtual panel discussion today, and I'd like to thank all of you for making the time in your busy schedules to join us this evening to discuss how critical health issues are being perceived during this federal election campaign. CNA has put forward 4 recommendations that are intended to guide the federal election candidates toward action that will improve the health and well-being of people in Canada. This includes increasing support for health workers through mental health supports and a national coordinating body for the workforce, expanding access to virtual care, meeting the needs of Canada's older adults through pan-Canadian long-term care standards and demographic-based federal funding, as well as fighting racism and discrimination. Before I introduce our guest speakers, there are a few housekeeping items I'd like to go over. There will be a Q&A portion, and you can enter your questions by hovering your mouse at the bottom of the screen and clicking on the Q&A chat box. We'll address as many questions as time allows. You can also provide comments and share resources in the general chat box, which should be to the right of your screen. We'd also ask that both the Q&A box and the chat box are used only for topics that are relevant to today's discussion. Today's session is also being recorded, and a link to the recording will be posted on CNA's YouTube channel following the event. Our moderator tonight is Andre Picard, an award-winning journalist who is one of Canada's top health and public policy observers and commentators for the Globe and Mail. He is joined today by our panelists, Karima Velji, VP Clinical Services at Ontario Shores, registered nurse and former CNA president, as well as Laura Greer, Senior Vice President of Health, Public Affairs and Hill & Knowlton Strategies, and David Coletto, CEO and founding partner at Abacus Data. On behalf of everyone at CNA, I would like to extend my sincerest thank you to the 4 of you for joining us today for what I know will be an insightful discussion. I'll now turn it over to Mr. Picard.
Great. Thank you very much, Aidan, for that introduction, for setting the stage for us. And thank you to everyone for joining us here tonight in the audience. Our goal tonight is pretty simple. With our expert panel, we want to explore what health issues have made waves on the campaign trail so far, and just as importantly, what health issues we aren't talking about yet and why. And hopefully we can influence that debate a little bit. All of this, of course, with the express purpose of helping you, the audience, make an informed decision at the ballot box. Now, the format is very simple. We're going to have a conversation, me and the 3 great panelists here. I'm going to ask some questions. We're going to invite you in the audience to submit questions, hopefully better questions than I have. And I'm going to incorporate them into the panel discussion throughout the evening. So let's jump right into it. We have a lot to talk about, so I want to dive right into the questions. And Laura, I thought I'd start with you. Maybe you can set the stage for us a little bit. Tell us what role healthcare has played in the campaign so far, maybe a couple of examples of what has gotten the attention of politicians so far.
I guess I'll start by saying, Andre, that healthcare hasn't got as much attention as I would have expected, considering this election was called in the midst of managing a pandemic, which never have we really seen so acutely how much health and healthcare intertwines with the success of our society and our country as a whole. So I was actually somewhat surprised we haven't seen as much as we have. There's been, I'll say, the very political pieces about whether individuals should be forced to be vaccinated, vaccine passports. That's really framed amongst some of those issues of whether government has a right to be involved in an individual's life, et cetera. That seems to be the most political piece. We then have had some other dabbling of, does Aaron O'Toole support privatized healthcare? Maybe a little bit of glimmers as there's a different announcement of the day, but it's not been a major theme of discussion. I'd say the major theme has been, why has Trudeau called the election, and debating that in the context of a pandemic. So I would like to see more discussion of it because we seem to always not want to have the hard discussions about healthcare. It's always something that as Canadians, we agree, we want a strong healthcare system, we want a healthy country, but it's really like not wanting to have the discussions about doing the hard work to get there.
And you raised the example of there was a little flurry of rhetorical debate about private versus public between the parties, kind of predictable. But is that one and done? Have we talked about that and we'll never talk about it again in the campaign, or do things come back?
I won't be surprised if it comes back at some point, maybe at the debate, or just knowing that privatizing healthcare is kind of the third rail of the healthcare debate in Canada. So I could see in particular the Conservative Party wanting to, in some ways, look for issues. It will not be them framing we want to privatize. Is it Jagmeet Singh poking that bear in the context of a debate? I don't think it will be their lead on any of it, but it will probably be come up as a way to cause a challenge for one of the parties in attempting to get a wedge. But it's almost been playing on that confusing part of there's always been private healthcare delivery in this country. It's that mixing that up about changing our universal healthcare system. I'd like to see some more discussions on how seniors care is funded. Can we move into those pieces? But I think they'll be used. It was funny, I was actually having a discussion today how we're almost sad that Maxime Bernier is not in the debate just for some good lines we could end up with there. But it may come up, but not a major focus, I think.
Right. And we'll come back to some of those issues and we'll talk about the debate too. What do we think is going to come in the debate, but we'll do that a little later. Karima, if you could, I want to ask you, I guess, the flip side of that question. What issues have the leaders not talked about that you wish they were? What are they ignoring? Laura hinted at one, the long-term care. What else do you wish they'd be talking about health-wise?
I mean, in the written platforms, there is an emphasis on COVID recovery. But I really wanted to play out, considering the timing issue of the election. We are right in the fourth wave and expecting 15,000 COVID cases by October in Canada. So if I just juxtapose that against how this election is playing out, I think COVID recovery, in particular, more strong emphasis on immunization and other infection control measures such as masking mandates, like it should take more of a louder kind of presence and stage in the election. So I certainly would want to see emphasis on that. The second one is the issues that were laid bare by the pandemic, such as seniors care, long-term care. The sector was ravaged by COVID, and we know what the root causes were. So I would want to see the parties address those in more depth than just saying we need standards for long-term care. We need very specific things to be corrected in long-term care, and we can get into that conversation later. And the third one, where there's a complete blind spot in my mind, is the immediate things that we are seeing in the workforce. Never have I seen this level of turnover in healthcare worker positions, nursing positions as an example, sick time. The number of vacancies in our region, and the region that I'm in, Durham, are so significant that services are being curtailed or closed. No one's speaking about that. So before we build a workforce for tomorrow, we really need to focus on how we are going to harness and keep resilient the workforce of today and retain the workforce of today. I want to see more emphasis on that.
Yeah, I think the long-term care one, everyone will mention, there's been 27,000 deaths in Canada from COVID, 18,000 in long-term care. I don't think it's really gotten the attention it should. You mentioned a good one, healthcare human resources. Our viewers are weighing in, children's mental health, the opioid crisis, decriminalization. So it's a lot of things that are not being talked about, and we'll try and wade into them throughout the evening. So David, I want to jump over to you and ask you another really broad question before we get into more specifics. And it's stepping back and just asking, does healthcare actually matter at the ballot box? Is this something that people vote on, or do they just care about it and vote about the economy or whatever?
Great question. I'm of the view, when I've been doing polling now for almost 15 years, even though I look like I'm 18, I'm not. And every time we have an election, healthcare is at the top of the list of issues people say that will drive their vote when we ask them. And so I always reflect, and I get pushback saying, oh, David, everyone says that. That's just what they say. But I actually believe they care about that issue, right? They don't answer that survey in that way if they didn't. So I do think it can be a vote driver. But to, the earlier points, if our leaders don't talk about it and there's nothing to differentiate the choice, then it doesn't become part of the calculus in how we vote, right? So the Conservatives, I think, work very hard to neutralize themselves on this issue. The Liberals are afraid to talk about it because they don't want to anger Quebec primarily. And the New Democrats would love to talk more about it, but have no one to play with. No one wants to play ball. So you're left with a situation where everybody kind of agrees that the system isn't perfect and we can do better, but that's not for now. Let's talk about something else that we can actually fight over. And I think it does a disservice to public policy development and to the debate, because I think, when candidates are going door to door, I have no doubt in my mind that, if they go to 10 doors, at least 3 of them are going to ask them about healthcare. And it's going to be even higher in Quebec and even higher in Atlantic Canada. So I do think people care about it, but the way our system works and the way the leaders offer up ideas means people may not actually be voting on a choice for which leader or party they think will do the best on that job.
It was part of the problem that there's actually not that much disagreement between the parties when you get right down to it, right? There's a lot of everybody loves Medicare across the political spectrum. Is that part of the issue? Is there's not a lot of distinguishing characteristics in the platforms?
Well, I think so, in part because it is provincial responsibility. So, if, to Karima's point about all those issues she wishes the parties and federal party leaders were talking about, many of them, the federal government has certainly a role, and they can help fund it and set standards and sort of guide a national conversation about them. But when you have a very popular premier in Quebec who just a week and a half ago said, hey, now stay the heck away from any strings attached to money that you might deliver, and Quebec is clearly, and it always is, critical to any party's success, I think that complicates, that ability to differentiate. But there's no doubt in my mind, when I noticed somebody, mentioned mental health of children. Now all kids are back to school. If we talk about a recovery, Canadians want to hear, how do we recover everyone and how do we get the system in place? And so if you actually had a politician who wanted to really listen to people, and I think the Nova Scotia provincial election, for anyone who's watching from there or paid attention, showed the power that healthcare can play, taking a party that was well back in second place, who put it at the center of their conversation, and a premier to be who said, I'm listening and I commit to doing something, surprised everybody by winning a majority government and tossing out the Liberals. So I think that's the evidence, Andre, that if the leaders wanted to, they probably could, but our federation makes that complicated, I think.
Okay, and we can talk about that federal provincial split a little later in more detail too. Laura, I wanted to continue on that theme about the politics of this. There's a famous quote that springs to mind for me. Premier Joy Smallwood of Newfoundland Labrador purportedly said once, I've never had a discussion about healthcare that didn't lose me votes. Do you think, is that sort of is it this fear driven by the politicians? They're fearful that you can only lose votes if you talk about healthcare issues because you can never satisfy everyone.
I also think it's a bit of something David touched on, is that healthcare is generally something we all agree on. It's generally more about how do we use our finite resources to address all of the challenges that are there. So I think it's not divisive enough of an issue almost to make it political. No one wants to say, I don't want to have improved children's mental health. No one's going to say, we don't need those new cancer treatments. Oh, we've solved all of our problems with wait times. That's not the case. I think we use that provincial federal divide. A lot of what really matters to people on the ground is at the provincial level. It's about access or being able to have the care and services you need when you need it. I think especially at the federal level, and I found that even just touching on that Nova Scotia election, even at the provincial level, we often don't see healthcare be the ballot question generally. It's always, as David again said, the number one issue people care about, but it's not the defining ballot issue. I think Nova Scotia played out in a way of really acute access issues that were fundamentally being played, that people were demanding a change and they've had to move forward with it. So what's in the federal rubric that they can actually offer that's going to make people shift to vote or get out there? I don't think it's political enough, because they will all agree we want Canadians to have the care they need. It's disagreeing around the margins about how we get there and how much we spend to do that. And the debates don't happen in the margins.
That's an interesting point you make. It's almost motherhood to talk about Medicare, and there's not these big differences, except I guess on COVID policy. That's the one that's really dividing the parties. That's where we're seeing the protests, et cetera, is on COVID.
And that's more about the role of government playing in it than actually about the healthcare delivery. I wish it was about the effectiveness of these vaccines and the role that it's going to play for recovery versus whether it's my right to refuse the vaccine or not. It's more that positioning that we really saw fueled south of the border, of the stay out of my place, this is me, don't tell me what to do. It's not actually about the discussion on how do we manage this fourth wave. Of, to Karima's point, we're in the fourth wave. We're seeing scheduled surgeries delayed. We're trending towards worse than what we saw in the third wave. We're not talking about that because it's become this issue of whether you government have the right to do it. So I don't even actually see that as much as a health debate, but a different type of political debate.
And Karima, I saw you nodding there. Bit off topic, but as a nurse, what do you think when you see people protesting outside hospitals, yelling at nurses, calling them vulgar names for being vaccinated? That must be so demoralizing after working in the pandemic for 18 months now, nonstop.
For sure, it's demoralizing, right? It wasn't just a protest. It was people spitting at nurses and healthcare workers as they were going to work, and using abusive language. It was so much more than a protest. So it doesn't help the morale of the workforce. That's really not in a good shape at the moment. And it's showing up in the turnover we are experiencing, the vacancies and so on. And these are the very people who've been showing up to work, keeping your immunization centers open, like trying to save lives and working short-staffed, not for 2 months in a row. It's been over 18 months. So I think the toll is significant. I mean, nurses have an oath of allegiance to care for people. So I don't think it will dissuade them from coming to work and caring, but it's exhausting. It is exhausting, and it's very demoralizing, I think, insulting, to be honest. And I really feel there has to be a zero tolerance stance to this. Like, protests are good. You can have freedom in terms of expressing yourself, but when you cross a line in the way we saw last week in many areas of Canada, that's not on. And I think we need to hear a clear stance from all parties about zero tolerance to its violence. It's violence.
Yeah, I think thankfully the major party leaders have been all on the same page on this one, that this is not acceptable regardless of what you think. Now, I want to ask you, given your experience, you've had a lot of experience with the CNA, doing some lobbying, et cetera. How do you make politicians care about these issues, especially during an election? And let's use, based on the chat, everybody wants to hear more about the nursing shortage. So use the nursing shortage as an example. How do you make politicians care about this and recognize just how severe this is?
I think there's a short-term thing. You can't recover from COVID until you address the healthcare issues of today. And I think you have to prioritize, because you can throw everything against the wall and nothing will stick. So I know when I was president at CNA, my real contribution was, let's focus our efforts. We can't talk about pharmacare, virtual care, home care, long-term care, all in the same breath and expect there will be uptake. So really prioritizing what we need to speak about, and then making those asks very tangible. So to give you an example, in every platform, or almost in every platform, you see an emphasis on we need national standards for long-term care. That's a very philosophical statement that can sit on a shelf for 20 years and not see the light of the day. So one, as a nurse or a nurse lobbyist, you have to get underneath that statement and unpack it for the politicians and make it relevant and talk about what's actually needed. There were many positive deviants, Andre, during as COVID played out in long-term care sectors. There were long-term care homes, as you may know better than me, who did it really well, who played out COVID really well in their organizations. Well, what were those success factors? They lie in basic hours of care that were given to people, the staff mix that existed in those long-term care facilities. Like, you have to get underneath a statement, long-term care standards, and talk about specificities. You know, did they have access to nurse practitioners? Did they have access to infection control resources? That's what differentiated the good from the bad. And there's a lot to learn from the positive deviants. Make the asks very, very specific so that politicians understand it. As nurses, we have the knowledge and the skill to understand philosophically what a standard means. A politician doesn't. You have to unpack it for them and be very, very specific in our asks, I think.
And Andre, if I could just add, I think from a public opinion perspective, I think, you know, when we ask people about what they worry about the most when it comes to the health system, and I think the pandemic put a spotlight on this, is that the system will not be there when I need it, right? And obviously that becomes more acute as you get older and you're feeling that your need for that system becomes sooner. But even, you know, if you're 30, healthcare is not as high a top issue, but it's high because we have loved ones and we never know when we're going to need the system. And I think the pandemic put that into spotlight, not just for those who needed care because they contracted COVID-19, but also because of all the other patients who couldn't get the care that they needed. And so from a lobbying point of view, that's the dot that you connect between, you know, the policy outcomes that experts like nurses and, you know, policy analysts that talk about with those deep concerns that people have. And a health human resource problem sounds very abstract, right? But not having enough nurses in the emergency room to deal with a capacity, or not having access to a family physician, or not being able to not having a pharmacist in your local community. All of those bridge that gap where people say, that's what I fear the most, is not having access. So I think telling that story and making it real allows then the politician to say, well, we've got to stop this problem, right? I don't want to hear my constituents saying that I haven't done enough to help solve that problem in their community. And that's, I think, how it's that story, that emotion that bridges the policy with the politics.
And adding the human face to it, like never undersell an election side or just the storytelling side of it, of this is Karima, she's a nurse. Like, there's a lot to unpack. Like, we were headed to a nursing shortage before the pandemic, so it's not like this is new. But being able to unpack, like, why? Well, we have a demographic push, though. There's just more people needing healthcare. And then we've got a pandemic. And here's what a nurse on the front lines is actually dealing with all of this together. And this is what it means in your community. And I think that's something for everyone on about how they can make this story of you as a frontline nurse, if you're a frontline nurse, what that means in your community and what are the risks going forward, as David said, to our community if we don't have that. And it's funny, when I was looking, when it framing at access, when I looked at the new Ontario, the COVID modeling data that was released last week, the first thing I said was, oh, I hope no one I know is being diagnosed with cancer or something, because it's not actually the COVID patients, it's what is going to happen to all of the backlogs and how do we actually manage, how do we ever get caught up in what, from delayed preventative care to everything. And so how do we bring those stories forward of what this means on a human level, both to the nurse and that shortage, but also to the people in the community who rely on those professionals?
I think we need more nurses telling the stories and better. But I see now physicians are telling the story of nursing. Like,
well, we had to redeploy physicians to be critical care nurses in the third wave because there were not enough nurses. We flew in doctors to do the role of critical care nurses, and that was a very real example of what is a shortage of these very trained professionals and what does it mean? Do we have enough people to care for you on the ward when you're on a ventilator?
It's
And
also
I have to say, Karima, as a media, we were frustrated that, nurses are hesitant to speak out. They're shy. They're worried about losing their jobs, and doctors just have more independence. So it's unfortunate that situation. But sorry, David, I cut you off there.
I was just also going to say on the nurses shortage. I mean, there's shortages in many sectors, right? I deal with a lot of clients who are all trying to figure out how do we recruit more people into our sector, and yet on the campaign trail, the natural inclination of politicians is to talk about creating new jobs. Well, there are hundreds of thousands of empty jobs that we can't find people to fill, and yet they don't really talk about how to solve for that problem, right? There's this, and so I think there's a paradigm shift happening as our population ages and our population kind of shrinks more or less, and over time, that we're actually going to have to think about solutions and talking about a policy in a world where we actually need to rethink how we talk about jobs, right? And how we fill those empty positions that are going to be needed, because it's too easy for a politician to walk out and say, I'm going to build a new bridge and that's going to create 1,000 new jobs. Well, even in that sector, good luck finding, tradespeople who can actually do that work. And the same is true if I'm going to build a new hospital, but if I got no one to work in it, it means nothing, right? And so I think there's the whole healthcare community will have to start, with every sector, start to reframe the way we talk about economic growth and jobs and link it to the fact that we're going to have long-term shortages in a whole range of sectors.
And I'll just point out in the chat, a lot of people are calling me to order, and rightfully so, for saying nurses are shy. They're saying actually they fear repercussions. The way they're treated by their employers is unacceptable. So I will correct that, and that is quite correct. Laura, I want to come back to you. You talked about the need to put a human face on these stories. Talk about the role of the media. If we were covering elections by following people or leaders around on buses, we're not telling those long-term care stories the way we were in March and April of 2020. Is that what we should be doing to get health on the agenda, to make it more real for the public?
Yes, it's telling the stories, but it's not going to happen on the campaign bus, as you were saying. Those are highly planned events of we're going to roll out this party's platform on health today, and we'll do it with a hospital backdrop, etc. It's not going to tell those stories that we really need people to think about. And there's shortage of voices in media being able to tell it too, but it takes more work than those scripted campaign events. But it's those really meaningful pieces that go into and show like a day in the life of a nurse, or what does it mean from the perspective, and bringing forward, but tying those stories to the policy solutions. And that's where an organization like CNA or others, how we meld together what are the human stories, reach out to media to say, here's a story that needs to be told, and here's the solutions. It has to be a so what to it, like what do we need to do to help fix it? So that's not easy. I started as a journalist way back. I spent years working at a hospital too. I used to have a much longer list of people who would be health reporters than I do now, Andre. And I almost wonder if still remember when Helen Branswell went to the States, where I used to work with her all the time on more science related pieces. There aren't as many reporters able to do that type of storytelling that you do more from the columnist perspective, but to bring forward too. So it takes extra work, but it's important. And I think it has a lot of impact. Are there ways to do this on social media and other forums too? That's a possibility as well. But to that point, do you have the time and space to do that? I think it's really about choosing what are those focused issues to really try to move the needle on, and having a way to tell those stories and get it out there, and find the reporters that want to tell them and link it to the campaign, but it's not going to happen at a campaign event.
Right. There's a lot of rich debate in the chat. So I want to come back to some of it, Karima. A lot of people are wondering, why don't nurses use their voice more? You're the biggest health profession. You're really on the front lines. Why isn't that voice used more powerfully?
Very thoughtful questions. I mean, there are 400 and almost 450,000 nurses in Canada. 1 in every 85 persons in Canada is a nurse. We are powerful in our numbers and powerful in our voice. I think the employment arrangements for nurses are very different than the relationships of organizations to physicians. So the freedom, the degrees of freedom by which you can exercise your voice in media, for example, is very different. So I think that's one issue. The second one is we don't get approached, Andre. Like we have to be approached to tell the story. So we have to really formulate relationships with journalists like you to engage the voice of the nurse in telling the stories. And the third point is a nurse is not the only one who can tell the story of nursing. The power of consumers, if we can leverage the trust of the consumers, which we are the highest trusted profession, if we leverage that and engage the voice of the consumer to draw attention to the issues, because we are the ones interacting with them in healthcare 24/7. If we leverage that, I think there is a powerful strategy there to be had. And I know CNA has been doing some work around engaging the voice of the consumer, but engage them to tell the story on their experience and then to be an advocate for what needs to be done in nursing. You saw that in long-term care, Andre. Consumers were the one who turned around the visitation policies for long-term care. Significant in their voice and in their approach. There is a powerful opportunity there, I think, for nurses that we can leverage.
Great. Now, David, I promised earlier that we'd try and do some crystal ball gazing about the debate. What does your polling tell you that the leaders should be talking about in the debate, and particularly health-wise, if anything?
Well, as I think we already mentioned, healthcare is a top issue. I was trying to recall, I tried to watch, my French language isn't that great. I tried to watch the TVA debate last week, and other than a few mentions of the transfer payments, I'm not sure a direct question was asked about healthcare. I could be wrong, but I don't recall it. So it's not there. It's not seared in there. And I think that's maybe a jurisdictional quibble that the TVA did not want to ask about. But, you know, I think, back to our point, I'm not sure, and I think Laura made a really good point. I'm not sure any of the leaders want to debate healthcare. Like they don't. There's no difference. But I do think as they get ready, it has nothing to. Well, maybe that's a little to do with healthcare. But if you paid attention to the campaign this past week, the Conservatives have gotten into trouble because they've had to flip-flop on a position when it comes to gun control. I suspect if I am, and I don't, but if I was advising the Liberals, you know, this question of, okay, Mr. O'Toole, you've promised to increase health transfers by 6%, but can we trust you on that? Because one other item of your platform, you've clearly changed your position on. So I do think healthcare will fit into a broader conversation about the differences in broad worldview that the Liberals try to differentiate from the Conservatives. To Laura's point, those differences are very minimal, but they will try to wedge them to appear to be much larger than they are. And so healthcare as one of those values of Canadian politics, it's a value that we have, that our system is the way it is. Even though when we ask people, how do you feel about the system? Almost nobody thinks it's working anywhere near as well as it should. And a sizable number think we need to completely overhaul it. There's still a value intention there. So I suspect healthcare will be embedded in the debates, but it may not. I don't think that you're going to see the leaders actually debating health policy as Karima really hopes that they would.
And Laura, what do you, you're a political junkie, what do you think they're going to talk about health-wise, and what do you wish they would talk about health-wise?
I think they will probably touch on, or I'll say more, have a throwaway question on mental health, possibly. I think it'll be what are those spaces that the federal government can play in that relates to the pandemic, and I'll say that forward-looking recovery, not the looking back side of it. I don't think it will be anyone will have difficult questions or significant pieces there. I do wish, and maybe it's the demographic I'm in, that more discussion on seniors and not just long-term care standards, but what does it mean and what are the healthcare supports we're publicly funding in this country for an aging population is a big philosophical discussion to have. Seniors vote too, so I would in some ways like to think there would be more of that, but they also probably don't want to alienate those voters, so we'll not discuss that in a debate. But I think these are questions that should be discussed because we do need to have more of a what is our national approach to this.
And Karima, I'll ask you the same. If you had the opportunity to ask the leaders a question at the debate, what would you ask them? What was the one thing you'd want them to tackle?
There's so many priorities, but if I were to pick my favorite, it would be the immediate COVID recovery and the workforce issues related to COVID recovery. But the second one that follows close to that, well, there are two: seniors care, and particularly the long-term care standards in very specific terms. And the third one would be mental health. And the time for mental health, I work in the mental health sector, so I'm biased obviously towards that, but the time is now. Everyone seems to be friendly to the idea of the resources far underway that needs in mental health care. So at least there is an acknowledgement of the issue of the resources are not in par with the needs. And I would hope to amplify, honestly, the message around for once and for all to properly fund the mental health care supports. But overall, I think I'm looking for a plan. Everyone can talk about philosophical priorities or the multiple things we need to address under universal health care. It goes nowhere, Andre. So for me, I would want to really pinpoint questions around what are the priorities and how will we resource those? If there has to be a plan with the priority, then it's real.
Yeah, all the parties have promises on mental health. They're fairly vague. And they're slightly different philosophically, but they're not detailed, that's for sure. And David, I want to come back to you on this question of long-term care. You know, there's so much interest in it. Why isn't it catching on as a debate topic? You know, there's been so many deaths. I've seen some polls saying, you know, asking people, do you want to live in long-term care? And it's about 95% no. So there's a real visceral concern about this, but why hasn't that caught on as a discussion?
Well, I think one of the, just as a side note, one of the things we don't see sometimes as observers is what's actually happening on the ground in these campaigns. And I think we saw a glimpse of the debate around long-term care in the French language debate and during the campaign. I mean, the Liberals have put out probably more policy on this than we've seen. They're promising to set national standards. They are putting money behind that. The New Democrats, Mr. Singh, during the debate tried to make a clear distinction between the fact that he's the only leader on that stage who would take the private element out of long-term care entirely, and tried to paint both the Liberals and the Conservatives as basically the same. So I do think there's maybe not as much as you'd like, Andre, because you know your book was so illuminating, and we should probably have one debate just about how do we reform and improve our long-term care system. But I think, at least my recollection, and it's because of the crisis that the pandemic really put a spotlight on. I think the crisis was probably already there, but it just made much worse, is that we are talking about it, at least, because I heard nothing about long-term care in the last federal election. And that was only, 2 years ago. So I think there's some conversations. And I do think that it is one of those questions that whether you are a senior and on your, getting close to that point where you're really worried about where you will be cared for, or you're somebody like my mother who's 60 but has a 93-year-old mother in long-term care. And that is literally the only thing that she thinks about, and it consumes her. So I think, in my view, what's missing in our debate, it seems to me, is empathy from our leaders. That nobody seems to be indicating that they actually understand what people are going through and what they've been through. And as a result, people just get upset and they look at these leaders and they say, they're all the same. They actually are just talking politics. They talk like, folks like me who live in the Ottawa bubble, and not like people like me who live my life every day. And so I think I think there's an opportunity there, but my experience has been that the politicians are political animals, and they act like that as opposed to act like people. But I really do think there's been some conversation at least, but there are so many issues swirling around that you almost can't, that this election isn't about long-term care. I don't think it's about anything specifically, but I do feel there's been more conversation about it at least than it's been in the past.
Yeah, some really good points. I think you've hit the nail on the head for me, is that I see all these promises of money, but I don't see that passion. I don't see the empathy for what's going, just the depth of the tragedy and the response to it from the politicians has been very neutral to me, and that's frustrating. And I like your comment.
The honesty,
comment
though,
also,
that
it's the election no one wants about nothing is very true as well. So it's hard to engage people as well.
And we're missing the honesty of people actually, like, this is a crisis now. Wait until my parents' generation become, in their 80s and 90s. Like, this is only going to get far worse, and nobody wants to talk about that. And I guess elections aren't great times to talk about that, but they should be, I guess. And maybe I'm too much of the optimist here and hoping for a better type of politics.
Yeah, wicked issues, Andre, in long-term care. It's tough. Like, it's not easy to solve the issues. So I guess when it becomes political, like in an election, you can very quickly hide behind jurisdictional issues and not step up to your leadership role.
And I almost think it's because
healthcare,
it was last year. It's almost too long ago for it to be the primary issue. And I think David captured it with we probably all want a different type of politics. It's been a long time since we had politics for policy making and what should we be doing. It's all done by focus groups and etc. And I almost think, like, we wouldn't have been having the election if we were where we were last spring, where we had so many seniors in long-term care dying. But now the issue just continues to be, why did we call the election? Because they don't have something they are passionate about. It's like that was too long ago that they can not touch on that almost.
Yeah, it's sad that we have such short memories about these horrors that took place. But
like, I'd almost want to ask, like, honestly, I sit there and go, this is like, we have seen what a health crisis has done to the world. What are we missing, or what should we do? Having what we've experienced the past 18 months, what would you change to make it better? I'd almost like one of those type of questions. It's like we didn't learn how dependent we are on the health of our country to function. And that's what I find the most frustrating about this, because we're having it like it's a usual election, not like we've just been through a seismic shift like World War II was to previous generations. It just doesn't feel like we're living that same reality.
The next risk, though, from a pandemic perspective, is on the other side of the demographic. It's the children that we have to watch now. And I would put my money and bet on it. It would play out differently. I think their ageism is a big factor in why we have such short-term memories of 15,000 plus seniors dying under our care. These were not seniors in their homes. We had promised to care for them in institutions who died under our care.
We're also not doing great by our children either. And I'll say that as complete sandwich generation, senior parents, young children in schools. We're not doing great by any of these populations, I'd say, right now, because it's not easy and you have to make hard decisions and hard work. The politics almost seems to be not ready to do the hard work.
Now, David, we talked earlier about this, federal provincial division of powers. It's always a constant issue in Canada. Can you give us a sense, what does the public actually expect from the federal government? What do they expect them to do on healthcare? Just spend money and shut up, or do they expect them to be more intrusive with, put strings on that money?
I think they expect what we expect of anyone who has leadership is solve the problem. Just do what you need to do. I'm always I always say that the public on this issue is well ahead of our political elites. Like even in Quebec, when we ask people, do you want the federal government to play a leadership role in making sure that a Canadian in any part of this country has equal access to healthcare? Clear majority of Quebecers even say yes to that, right? And yet, Andre, I always bring back to this story. We were at an event where the previous premier of Quebec, Philippe Couillard, his first public appearance, we asked him, why can't federal politicians talk about this? Well, because people like me won't let them. Premiers of Quebec won't let that happen. But I see I think there's an understanding of the public that yes, local authorities and devolved policymaking probably is the best way to deal on the ground. But there's a role that the federal government can play in ensuring that as a country, that the health system is the same everywhere, right? And so I honestly do not believe that if Justin Trudeau or Aaron O'Toole or Jagmeet Singh tomorrow came out and said, I am promising to play a greater role in making sure our healthcare system works. If they did that and none of the premiers said anything, I don't think the public would react negatively. The only thing that would cause the negative reaction is when others and other levels of government want to play politics with that, right? I honestly think that the public just wants to solve the problem and get things done. So, but that's not how our system works. And the politics of the federation get in the way. And I mean, I think you saw elements of it on the childcare discussion, right? We were close to having almost every province sign on to a national childcare deal. The federal government consistently and often gets involved in provincial jurisdiction. Sometimes with Quebec, you have to take a step back, not put a lot of strings on that. But I do believe that the public would accept more intervention as long as they felt that Ottawa wasn't telling a province or a community what to do, but was leading and guiding and setting set of standards.
And Laura, could you weigh in on this? I'm interested, is the role of Ottawa to just bribe the provinces to do the right thing, or do they use more stick and less carrot? What's the balance there?
I think with the Quebec piece, it's going to largely be bribery, but where I do think a key role for the federal government is ensuring that we're tackling these issues nationally and not leaving it that certain regions of the country are completely left behind on where it goes. I think we need infusions, and mental health is a key area that's been underfunded and not dealt with for years. Existing, I'll say, provincial spending in those areas needs the infusion from the government. So I think anything to spearhead where are areas that need a concerted national effort is where the federal government could do. And I think we've touched on, and CNA's had in their platform, key areas there, whether it's seniors, whether it's mental health. It's largely by giving the funds, but that they've got to do it so that there's some timelines or some pieces that get to action and not just flow it to cover everything. I don't think it's ever easy because Quebec will not accept generally those strings, but I think sometimes if you make the conditions right, you can have more of that discussion at the FPT level too.
Yeah, and Quebec has certainly accepted federal money with conditions when the timing is right and when the program is right, et cetera. So, and
like past mental health funding from the federal government has had strings for the provinces or tied to where certain outcomes trying to measure to, et cetera. Not on probably the scale that's needed, but I think it's really defining what are those problems that need a real national approach in making it something that, and again, making it, what does it mean at that patient, or as Karima said, the consumer level? What are we trying to change or improve so it's not just vast transfer money going, but we're trying to create this out of the funding so that people can also hold government accountable for it. We need to be able to picture what we're trying to solve from it. And one thing that we always see, and I don't know, David, if you can speak to this, these levels of money are so huge that to the individual person, it doesn't mean anything to them. So how do we make tangible, what does that actually mean if you've got a mother in long-term care what does this actually mean, or what do we want it to mean? Like, that's what I think we're kind of missing, is that vision for, and that's where politics can get involved. And like, what do we want it to be? And then policymakers figure out how we make it happen there. But we don't really have that vision that says, this is what we want. We want every Canadian to be able to age with dignity in this. And like, those kind of pieces, there's
Philosophy.
room for that.
I think it's an, what shall I say? You are giving up on your responsibility if you don't tie some accountability to the money transfer, because the jurisdictional approach and the federation isn't working for healthcare. Look at the way we perform in the world, our healthcare system. And leave alone the healthcare system and talk about the social determinants of health, things that actually determine health, the disparities across our country and the vulnerable societies, like, this thing of systemic racism, we have to get underneath again that word and remove those disparities. And the federal government has to leverage, has to take advantage of what power they have available to them. And the transfer payments are a powerful tool to tie some accountabilities. I mean, the jurisdictions cried for it when we were talking about vaccine availability, vaccine passport. They are looking for a national kind of standard and approach. The same approach can be used for amplifying funding to the sectors and the societies that need it. But accountabilities have to be there. Otherwise it's money that just goes in like an operating fund, a global fund, and then jurisdictions make their own determinations around the best way to use that money. And at the end of the day, it's very difficult to account for the value we created with those resources.
And Karima, as nurses, you work with the provinces, you work with the federal government. What do you do to encourage them to cooperate and to not hide behind the Constitution all the time? What can you do at your level?
I think there are a few things. So one is advocacy and policy efforts that are directed to the different levels of government for the different issues. So the more aligned that voice of nursing is between the provinces, territories, and CNA, the better. I mean, the alignment of vision and priorities, I think, can be a crucial strength. So continue and make sure the policy and the advocacy is in very evidence-based specific, like very specific terms. Forget the motherhood statements is what I would say. But the second thing is an equal effort, if not more, directed to rallying the consumers and the partners, rallying the physicians in your support, rallying the consumer non-governmental groups in your support, and so on. Really take advantage of the numbers and the trust we have amongst the consumers for our profession. So I would say play that up, because otherwise it's too political and it plays out every election cycle and so what. But that consumer voice and advocacy can be a forceful impetus for change.
Great. Laura, I like how you've magically put some furniture in behind you. That's very impressive.
I did that because there was lots of daylight when I started, and I don't have the lights on, and it's now a big rainstorm in Toronto, I believe. So it has gotten very dark out. So it was looking like I was in a bunker for a while.
Yeah, you were fading away a bit. I was worried. So I'm glad you did that. David, I want to ask you, there's a bunch of questions about, big issues that we haven't touched on: climate change, Indigenous issues. I've kind of avoided those, but does the public see those as health issues? Do they see it separate? I'm interested on where people actually draw those lines. Is health just about medicine, or?
It's a great question. I think on climate change, we're seeing more and more alignment or convergence between people's concern about that issue and their recognition that it's actually it's already and going to continue to impact their health, right? I think that that alignment is going to be a very powerful motivator to driving also policy change on the climate change front, that people are starting to really feel that, whether it's extreme heat in British Columbia killing, people, whether it's forest fires, whether it's rising water, you name it. I mean, I don't have to go through the list of things that this country's lived through for the last year, but people are starting to see that. So I think you can connect, and that's a powerful thing. I think any issue that you can connect an individual's personal or family health to, becomes even more powerful, because the health is the thing we cherish the most, right? Then people worry about money, but the two, health always comes first. On Indigenous issues, talking about issues that hasn't really been discussed, but the country kind of woke up to a reality that they didn't honestly know. And that's the thing. We did a survey with the Assembly of First Nations and the Canadian Race Relations Foundation that showed when those discovery of those unmarked graves happened earlier this year, most Canadians were shocked to learn about that, right? And so reconciliation and the role the federal government actually plays in delivering health care on reserve is an issue that I think more Canadians want to hear about, but isn't being discussed. So I do think there are big issues. Like it's, and I will say, it almost feels sometimes overwhelming, right? If you're just, we live this, the four of us all the time, and so we kind of maybe become a little bit immune to these policy but if you are somebody sitting in your living room watching the evening news, it's overwhelming, the level of challenges that the world is facing, whether we're talking about the pandemic or climate change or what's going on in Afghanistan. And so it does feel that like the politicians in a way can't focus because there's so much of it. And so in a way, it feels like we're not talking about any of these things, when in reality, I think there's just not enough time to tackle them all. And so then ultimately politicians and political strategists go to the issues that often will divide us, because that's how you win elections.
Laura, I wondered if you could build on that. You mentioned earlier about us having very short memories. How could it be that we had such intense coverage of these unmarked graves a few months ago, and there's nothing during the election campaign?
It's short memories, and I think to the point of what is the best opportunity for a wedge. So guns appeared as the big one most recently that caused them, because they saw an opening, and how do we extrapolate from that? It's short memories, and I think people not wanting to necessarily to engage in the big discussions right now. I think we were somewhat symptomatic of a summertime unnecessary election call, that also to have the public engaged on it, there's just not as much willingness from the public side too.
Now we're almost out of time, but there's a question that keeps coming up over and over in the chat that I'm going to put you all on the spot for to end. Now, we made a real effort. We said at the outset, we're not going to be partisan, but everybody's interested in what's your view of who has the best platform of the parties. And if you don't want to answer that directly, maybe tell us some of the highlights of what you think some of the best health promises are out there. I'll get each of you to do that before we have to go to our wrap up. Karima, do you want to start? Who's doing the best job on promising healthcare change?
See, I like what I see in the NDP platform, to be honest, because they cover the whole, everything's there. Everything that you can fit under universal healthcare and wicked issues that need to be tackled are all there. So in terms of highlighting the key issues that need to be tackled, I think that platform describes them the best way. I don't see prioritization, and I don't see a plan. So when I put all of that together, it's pretty neutral. I would say I don't see a difference. I don't see a difference between the platforms on a clear vision with a clear plan and a resourcing attached to it. Much to be desired. So I would say all the platforms look the same in that regard.
Yeah, and the NDP has really thrown in everything in the kitchen sink there. There's pharmacare, dental care, mental health care, senior strategy, health human resources, ending ending for-profit care. So there's a lot there, but people kind of question, it's easy to make promises if you don't have a big chance of taking power. So interesting platform, you're right. Laura, I'll put you on the spot with the same question. Who's doing it best, or who's making the best promises?
Well, I will say on the NDP, it's also not really new for them either. And it's just building on a lot of what they would have positioned before. Particularly looking at health, I'd say they're all pretty equal in that no one's bringing something I'd say unexpected or new to the table when it comes to healthcare. I think everyone has to address the main points. We've touched on those key ones there, but it gets down to I would like to see better, how do you work with the provinces to make it happen? And that's what's missing for me. So that's a non-answer to your question, but I'd say they're all touching on similar points and none of them stand out for me as being particularly different in healthcare.
So let me ask you then, because you didn't answer directly, to make it happen, do you need a majority government or can you do that with a minority government?
I think minority governments are very challenging to make significant things happen. So I would say for significant change, or if you want to really do it, a majority government makes it much more easier to happen because you're not always worried about confidence votes.
Okay. And David, the final word, who's made the best promises in your opinion?
Well, I'm going to flip slightly and I'll say when we ask Canadians who they think, of the three main parties, who do they think has the best plan? And I think it speaks to everything we've talked about. No one really comes out on top, right? 27% say Mr. Trudeau and the Liberals, 23% say Mr. Singh and the New Democrats, and 21% say Mr. O'Toole and the Conservatives. And then everybody else says either one of the other parties or none of them. And I think the fact that no one has a really clear advantage on it speaks to the fact that they aren't willing to put their necks out and really differentiate. And so while it's a top issue for people, when voters sit down and say, okay, but who's really going to change anything? Ultimately, most people look and say none of them. And so it becomes about who do I fear will do the worst, not who will make the best. And that's where healthcare often is played in our federal elections anyway.
Well, that's a great end to a really fascinating discussion, a little bit of a depressing end, but very, very thoughtful and insightful. Thanks for that. And I want to thank the panelists, Karima Velji, Laura Greer, and David Coletto for being there tonight. And I want to turn it over for a few final words to Aidan Hamza. Thank you to say some final thank you. So Aidan, over to you.
Well, once again, thank you, Andre, Karima, Laura, and David for the insights that you've provided. You've certainly given us quite a lot to think about today, from the lack of divergence between the parties on the healthcare platforms, for barriers for nurses to participating in these discussions, issues that we want to hear more about, like long-term care, mental health, the workforce. I'm sure all of our participants today have quite a lot to think about after this. So I'd like to thank you again for taking the time to be here with us today, and I hope everyone enjoyed the conversation. Thanks so much on behalf of CNA.